Liposuction is one of the most frequently performed cosmetic procedures in the United States today. In liposuction, what we do is we'll take a cannula, which is a hollow tube with a blunt end, and actually go and bluntly break the fat up in different areas of the body and suction it out. When we do that and we look at that area afterwards, it looks like a honeycomb because we've taken that cannula and we've created all these small little tunnels to remove the fat. Once that's done, it's very important that all those canals collapse uniformly on one another so we can have a nice smooth contour afterwards. For that reason, after liposuction, we'll place patients in a compression garment, and that can be anything from 2 pairs of pantyhose to 2 pairs of pantyhose and an abdominal binder to possibly something like Spanx. It's all kind of dependent on what we did and the type of patient we have. Now, it's important to maintain that compression pretty much 24/7 for the first week. After that, we ask the patient to continue for another 3 weeks for a total of 4 weeks afterwards. The compression helps to get a nice smooth contour. The abdomen is even more important because oftentimes we'll see more loose skin on the abdomen than we would the hip and thighs, and as we bend and flex and sit, we can create creases that might be permanent if we don't pay close attention to that. So it's very important, especially in the abdominal liposuction, to pay close attention to the post-operative compression. We tell patients not to drive for 3 or 4 days afterwards and until you're off pain medication. You actually won't hurt yourself by driving, but very likely you're not in the best condition to drive, and you may think twice before you make a quick move while you're driving the car. Probably the last place to give up the discomfort in liposuction is in the flanks along the midline in the back. And oftentimes 2 to 3 weeks later, patients will still tell us it hurts a little bit, and we tell them that that's very normal. Bruising normally is gone in 2 to 3 weeks, and the actual swelling will dissipate differently in different people. Oftentimes, the patient will actually notice some gain in their girth immediately after surgery as they're holding on to fluid. But in general, about 80% of that swelling is gone in the first 2 to 3 weeks, and the last 20% might drift off in the next 4 to 6 weeks.